Okay, today I have my husband and my parents and my first son here watching my speech. So I'm gonna hand the video over. Okay, so today I am going to be giving a speech on coronary artery disease. It is estimated that over 20 million Americans are affected by coronary artery disease, and the American Heart Association estimates that one person has a heart attack every 40 seconds. Understanding what coronary artery disease is imperative to its treatment and prevention. Today I will outline what coronary artery disease is, its causes and symptoms, and as well as treatment options available. Understanding all of this will hopefully prevent development of serious disease, debilitating symptoms, and possibly premature death. First, I'm going to start by explaining to you the anatomy of the heart. The heart is a muscular organ that pumps blood and oxygenated blood throughout the whole body that allows nutrients and oxygen to get to all your tissues, including your muscles. The heart itself is comprised of 3 layers. You have the inner lining, which is a smooth endothelial layer. That is the endocardium. The middle layer is a thick muscular layer called the myocardium. And then on top of that, you have the epicardium, which is also known as the visceral pericardium. That's a thick connective tissue layer. The endocardium of the heart itself is continuous with the endothelial lining of the blood vessels. And then so you see here all of the major blood vessels which pump the blood throughout the body, and then these smaller blood vessels here, those are your coronary arteries. These are what supply blood flow and oxygen to the tissues of the heart itself and the myocardium, which allows it to continually perform its functions. Coronary artery disease comes in many forms. One of the forms is called atherosclerosis. This is when fatty deposits of cholesterol form in the endothelial lining of the blood vessels, and that can block blood flow. It can also come in form of inflammation, and when there's inflammation, the blood vessels will thicken, and then that in turn will cause a blockage just by the hardening of the arteries. So there's many different factors that contribute to developing coronary artery disease. The first is genetics. There's family history puts you at risk to having coronary artery disease, especially on your father's side. Any male relatives will have a direct link. You also, age is a factor, so anyone 50 or older is more at risk of developing this disease, as well as men are more at risk to developing the disease. One of the large factors as far as coronary artery disease is a condition, it's high blood pressure. So when your blood pressure is really high, it's pumping really hard, and there's a lot of pressure built up on the artery walls. This in turn causes them to thicken to accommodate the extra pressure, and that will cause them to harden and eventually occlude them just by getting thicker and trying to accommodate the blood pressure. Blood cholesterol also has a factor because the plaque that develops inside of the lining and all the blockages are caused by cholesterol. So if you have a high blood cholesterol, you have a higher risk of it forming deposits and plaque in your arteries. A person that has coronary artery disease can have a range of symptoms. Some of the more important ones are angina, which is chest pain, shortness of breath, heart attack, or a complete heart failure. All of these are caused by the blocked blood flow to the myocardium, which will cause ischemia of the heart tissue. So ischemia is tissue death. So any area of your heart that's not getting blood pumped to it by the coronary arteries because of the blockage will die off, and then that will cause pain and other issues because it's not helping the rest of the heart to pump, and that will cause the pain, the shortness of breath, the heart attack, or the heart failure. So there's many different types of treatments available for coronary artery disease, and that depends specifically on when it's caught and how advanced it is. So there's different preventative treatments that can help you from developing advanced coronary artery disease. Those include eating low levels of dietary cholesterol. So if you keep your blood cholesterol levels down, there's less chance of it forming the plaques inside of the arteries. Staying at a healthy weight is also good. anyone who is overweight or higher weight is more at risk of developing hypertension or high blood pressure, and that's one of the very big contributing factors to coronary artery disease. Regular exercise is also really important because that allows easier return of venous blood to the heart, and it allows constant blood flow, which keeps the blood flowing, pushing through the arteries, keeping the plaque from building up, and it keeps everything just flowing better. There's also pharmaceutical drugs that help with this disease. Anything that manages cholesterol, like a Lipitor, will be beneficial to someone, as well as managing high blood pressure. Will also help with pharmaceutical. It will help with pharmaceutical interventions. And then as well as that, you need to manage inflammation in the body. So any kind of anti-inflammatory, that's why they have people take baby aspirin to prevent heart attacks. It's because keeping the inflammation in the body down will also keep the inflammation in your blood vessels down, and that will help them from preventing to become the atherosclerosis and the thickening that will block off the blood flow. Now, if you do develop coronary artery disease and you can't, and the pharmaceutical and just diet and exercise aren't working for you, there are medical interventions that can help prevent heart attacks and more serious symptoms. Some minimally invasive technique is called transluminal percutaneous angiography. So this is when you use an endovascular approach, so it's inside of a blood vessel. They will thread a catheter through the blood vessel down into your heart where the blocked coronary artery is, and they'll inflate that balloon. The balloon in turn will push back any kind of plaque deposit, and it will also open up that blood vessel if it's constricted, and that will reestablish the blood flow. At that time, they may also place a stent to hold the blood vessel open if the thickening of the wall, and it's not just a plaque deposit that's blocking it off, will help hold it open. This procedure does have a lot of risk associated with it, so it's something you definitely need to discuss with your doctor. Now, if just a minimally invasive procedure won't work, and you have more advanced disease with multiple blockages or serious blockages, then surgery may be an option. So the treatment for coronary artery disease surgically is a coronary artery bypass graft, also known as a CABG procedure. This is when they take a graft from your body, so it may be your saphenous vein, which is in your leg, or it may be your internal mammary artery, which is in your chest, and they will dissect that vein away, and then they will graft that vein below the blockage of the artery, and they will attach it to your aorta so that any oxygenated blood pumped out of your aorta will also flow to that tissue. So that will keep that muscle, that's the heart muscle that's below the blockage, oxygenated by flowing blood from another source. Obviously, it's open heart surgery. It involves cracking the sternum. It's very serious, only done if absolutely necessary. So if you use the preventative treatments earlier that we talked about, diet, exercise, and managing with pharmaceutical drugs, you may not have to get to that point. Now that you have a brief understanding of what coronary artery disease is and how it affects the heart and how it can be prevented and treated, maybe one less person will be affected by this disease and one less person will have a heart attack. That's it.